evening, everyone. We would like to thank you for joining us this evening at our town hall, Youth and the COVID-19 Vaccine. My name is Nadia, and I'm a health promoter on the school health team here at Niagara Region Public Health. I'm very excited to be your moderator for this evening's session. Joining me is Niagara Region's Acting Medical Officer of Health, Dr. Hirji, who will be discussing the COVID-19 vaccine and answering some of your questions on this topic. So before we begin, I'd like to quickly go over a few housekeeping rules. We have muted everyone and cameras will be kept turned off. However, if you have questions, you are still able to type it in the chat box. Please be respectful of those in this meeting. This is a safe place to ask questions. If you have any questions you would like to be answered, please put them in the chat. We will try to get to as many questions this evening, but in the event that we run out of time, you can visit our website for more information, and also a list of resources and contact details will be put in the chat also. To hand it off to Dr. Hirji, who will share some brief information before we start the Q&A. And at this time, if you have any questions, please type it into the chat. Dr. Hirji, I'll pass it off to you.
Okay, great. Thanks so much, Nadia. And thank you to everybody who's signed in to join us today. This is really going to be about your questions, so I don't want to say too much, but I wanted to maybe just start off with a few quick introductory comments just to highlight why I think, the topic of youth and getting the COVID-19 vaccine is so important. And I'll just quickly start off by showing this graph here, which shows who has actually already been vaccinated here in Niagara. And I'll just add in here a little bit of who is actually currently booked to get a vaccine. And you can see the majority of people in Niagara, and actually majority in almost every age group, has already gotten vaccinated, which is really good news. And you can see with our oldest groups in the bottom of that graph that we have almost everybody in those groups vaccinated. Some of those percentages are above 100% because we're using a Statistics Canada estimate of how many people are in that age group. And obviously the estimate isn't completely accurate because it's done in a year between a census. But if you look at the top of that age group, you'll see that the number of people getting vaccinated in that age group really falls down a bit lower, with it being lowest in that 12 to 17-year age group. And so the people who are youngest in Niagara are the ones who are still most at risk of COVID-19 because they don't have vaccine. So that's a picture of vaccination. If we flip over and take a look at what happens with cases of COVID-19, I think, we've all heard about the really tragic outcomes that have happened with COVID-19 in long-term care homes and senior residences, and how it's really been a terrible disease for our elderly. If you actually take a look at how many people within the elderly age groups have gotten COVID-19 versus our younger age groups, these are actually what the Canadian statistics look like. So, just under 20%, 19.2% of people under the age of 20 have gotten COVID-19, or sorry, 20% of cases in Canada, about 19.2% of cases in Canada have been amongst people under the age of 20. Only actually 9.2% of cases in Canada have been people in the age of 70 or above. So while COVID-19 has gotten a lot of attention for how severe it has been for elderly, and it has absolutely been most severe for them, we actually have more than twice as many people getting sick from COVID-19 actually under the age of 20. And so it's a disease that actually does affect our young people quite a bit as well. Fortunately, it's not nearly as severe amongst young people, but that's not to say it isn't severe sometimes. And so we've had, about 1,300 young people in the age of 0 to 19 who've been hospitalized with COVID-19. We've had 165 people have to go into an ICU, often bring on a machine to breathe for them. And tragically, there have been 13 people in Canada under the age of 20 who've actually died from COVID-19. And so when we have these people under the age of 20 who are not yet vaccinated, this is what we're really worried about in public health, because we don't want to see any more numbers in any of these age groups. Now, you may have been paying attention to some of the news, and there's a lot of talk these days about this Delta variant. And what this Delta variant is, it's basically a mutation of COVID-19 that's emerged. And it's currently actually now the dominant version of the virus that's circulating in the United Kingdom. And if we take a look, there's some pretty worrying headlines coming out of the United Kingdom. And actually, a lot of them are about young people. And so, this is by the NHS, which is the National Health Services in the United Kingdom. And it's talking about how COVID variant is hitting a lot of young people in their hospitals. So a lot of young people are getting hospitalized because of this Delta variant in the United Kingdom. Delta variant is surging here fastest among school children. So it's really affecting their young people. 79, cases are up 79% in a week, and it's young people who are really taking the brunt of that. And then this is actually some US news here about talking about why young people should be concerned about that Delta variant. And so there's a lot of concern about the young people and how the Delta variant is hitting them. Just taking a look at what's happened with cases in the UK, this has kind of been their case curve over the last month and a half. And so you can see things were relatively lower there, but they've gone up actually fourfold in just the last 4 weeks or so. So they're seeing a big increase in cases, and that increase is very much among young people. And this is actually what the breakdown of their cases looks like. The red on the left side is females, the green on the right side is males, and then you can see the different age categories. And you can see it's widest around the 20 to 29-year age group, and then next widest for the 10 to 19 age group. And so that Delta variant, very much like those headlines are saying, is really affecting the youngest people in the United Kingdom the most. And that sort of makes sense again, because the United Kingdom, like us, vaccinated elderly people first, and I think rightly so. But that has left young people who are the ones unvaccinated. And unfortunately, they're the ones who are now getting sick from the Delta variant. And that Delta variant does seem to be a more severe version of the virus. We saw the President of the United States, Joe Biden, last week, just talking about how it's particularly dangerous for those young people. This is another news article highlighting how the Delta variant is hitting young people hardest. And I think with the Delta variant potentially coming to spread here, we absolutely want to make sure all of the young people in our society are protected from COVID-19 because they've had the vaccination. And really, that's what today's about. An opportunity to hear your questions, help you understand more about the vaccine, and hopefully help you make the right decision for your child. And we certainly hope that decision will end up to have your children be vaccinated so they don't see any of these severe outcomes. And with that, Nadia, I'll turn it back to you to start answering some questions.
Thanks, Dr. Hirji. All right, so the first question we have is, are vaccines safe?
Yeah, so this is obviously probably the most important question, I think, for everyone. Vaccines are absolutely safe. Now, I think we can't overstate things. Nothing is ever going to be 100% safe. There's always a risk to anything. Getting in a car, driving, there's some risk that there's going to potentially be a collision. And so there are occasional side effects to the vaccines. Most of those side effects are actually right where you get that injection. You're going to get some pain, some redness, some swelling from that. More rarely, there can be some allergic reactions to the vaccination. And if you come to one of our public health clinics or you go to your primary care provider, people there know how to make sure you're safe after you have one of those reactions. And that's one of the reasons why you wait 15 minutes after your vaccination, just to make sure you're not having one of those side effects so we can make sure to treat it. More recently, I think there's been a little bit discussion about this idea of myocarditis happening, which is an inflammation of the heart. We're still not sure if it's linked to the vaccination because the numbers are very small, but we pay very close attention to anything going wrong with vaccination because, of course, we want to make sure people are safe when they get the vaccine. And we've seen a few people get it. It might be linked to the vaccination, but fortunately, what this really ends up being is it's a little bit of chest pain. It's, sometimes people feel a little bit weak, but everybody has recovered from it so far in the world who's gotten this that we've seen. It's something that's actually treated with just simple medications like Tylenol or ibuprofen or something like that. And no one's had a bad outcome from this. And of course, we see on the flip side, I showed you some statistics of COVID-19 where lots of people have been hospitalized and unfortunately a few people have died from COVID-19 in young age groups. And so I think in the balance of risk and benefit, it's absolutely far more dangerous to get COVID-19 than it is to have one of the side effects from the vaccine.
Okay, next question. Are there differences in receiving a Moderna shot versus the Pfizer vaccine?
Yeah, this has been a real hot topic, and there's no real difference between these two vaccines. I kind of liken it to two different brands of bottled water. You have different brands of bottled water are selling you water that tastes the same, basically has the same kind of mineral components inside it, but it basically just has a different brand name on the bottle because it's a different company making it. And that's really the difference between the Moderna vaccine and the Pfizer vaccine. It's two different drug companies who developed basically the same vaccine. In all the clinical trials, it had the same safety, it had the same effectiveness, it works the same mechanism in your body. It's just two different brand names on the same kind of vaccine because two different companies are selling it.
Okay. Why should I get my kids vaccinated when the adults are vaccinated?
Yeah, so that's a really good question. And so first response that I'd point out is that while the adults are vaccinated and they hopefully create this ring of protection around children, that ring of protection isn't impervious. Children are going to be going out of the house. They're going to be joining you when you go to the grocery store. They're going to be perhaps doing some summer activities this year. They're going to go on play dates with their friends. In the fall, they're going to be going back to school. And they will be around others, and they will have the chance to get COVID-19 just because they're around others. So they're not going to be completely safe. If they're staying home, yeah, absolutely. If everybody else in the home is vaccinated and they never leave home, sure, they're going to be pretty well protected. But they're not going to be protected once they leave the home and they're around other people. And so first off, you want to get them children vaccinated so they have that protection themselves. They're not at risk when they go out and about. And particularly importantly, when they go back to school in the fall, you want them to be protected. The other part of the argument here is that no vaccine is 100% effective. Our Pfizer vaccine, our Moderna vaccine are incredibly good. For vaccines developed in only a year, they're 90% effective. So 90% reduction that you're going to get COVID-19, but that does still mean a small number of people will get it. So even if there's this ring of protection of adults around a child, there is still a risk that those adults could get COVID-19 and pass it on to the children. And of course, the other part here is that if a child gets COVID-19, they could pass it on to an elderly parent or grandparent or uncle or aunt who unfortunately likewise might be vaccinated, but still might end up getting COVID-19 because the vaccine isn't 100%. And those are the groups who are really at risk of being hospitalized, of potentially passing away from COVID-19. And we absolutely don't want that. And I'm sure no child wants to see that happen to their parent or grandparent or aunt or uncle.
Mm-hmm. Can the vaccine impact my ability to get pregnant?
Yeah, so this is a rumor that has started to spread on the internet. And there is absolutely no scientific basis for this rumor. It is something that someone once started talking about and seems to have caught fire and spread. There's absolutely no scientific studies showing that the vaccine has any impact in people's fertility in their ability to have a child. And in fact, if we look at all the vaccines that we've ever developed in the world, we've never had a vaccine that actually affects people's fertility. It's just not something that happens with vaccines. So there's really no reason to think that this would be a concern. The kinds of things that we see with vaccines, I talked about are you could get pain, redness, and swelling at the place where you're vaccinated. You could have an allergic reaction. There's, certain rashes that sometimes happen after a vaccine. We're seeing this myocarditis issue right now that we're studying very carefully to see if it's linked to the vaccine. We've never seen anything around fertility or ability to have a child affected. And thus far, anybody who has an unusual occurrence after a vaccine, it gets reported to us in public health. That's why we know about this myocarditis issue, because some people happen to get it after getting the vaccine. We don't know it's because they got the vaccine or it's just the random luck that's, 80% of people in the world get vaccinated. Everybody's going to have at some point an illness after that. And is it linked to the vaccine, or would they have got that illness anyway? We've not seen anything about reproductive issues after people have gotten the vaccine. So we are pretty confident that it's not an issue.
Okay. And this next question ties in perfectly. How are adverse effects being recorded in Niagara?
Yeah, so if you have an adverse effect after your vaccination, what you should do is you should go back and see your healthcare provider, or you should give us a call in public health. Ideally, we really recommend seeing a healthcare provider. They will assess what that adverse effect is, and then they'll actually send a report to us in public health so we can have the report of that. We may actually reach back out to you to collect a bit more information, and then we're cataloging all of that in a database. If this is an adverse event that we're concerned about, it would be an issue for you getting a future vaccination, say you had an allergic reaction to the vaccination, we may give you some advice of what you should do about your second dose of vaccine, or some things, maybe see an allergist before you get to another vaccine so we know exactly what that allergy is. In other cases, we'll advise you it's safe to keep getting your vaccine, but we'll keep a record of what that adverse effect is. And everywhere else in Ontario, and actually in Canada and really around the world, is doing the same thing. And if we start to see a pattern of this issue seems to keep popping up after someone's had a vaccination, that gives us a signal that, yeah, maybe there is something like this and we need to look more carefully at it. That's why the myocarditis issue has actually popped up on our radar, because we've started to see a little bit of a pattern there. It's about the same number of cases we'd expect to see if we, just regularly. So we're not sure if it's linked to the vaccination, but it's come on our radar to pay close attention to. And if anything else comes like that, it'll come onto our radar as well. And the way that happens is by making sure you see your healthcare provider if you have an unusual event after your vaccination.
Perfect. So the World Health Organization is not recommending children get vaccinated. How is Canada approaching this?
Yeah, so before we use a vaccine on anybody, we want to make sure that that vaccine has been tested out to make sure, first of all, it works. You don't want to give a vaccine that's not going to work to people, and you want to make sure it's safe. And so when the vaccines were first approved, they were approved only for adults, because the clinical trials, the research studies done, tested it out on adults, because we don't want to test it out on children first. We want to test it out on adults who volunteered to be vaccinated. Once we got it tested out on adults, the companies have actually gone back now because they now know it's safe, and have started to do tests on research studies vaccinating children to see if it works well there as well. And the good news is that the Pfizer vaccine, they found out for children aged 12 and up, it was very effective and very safe. And actually Moderna has found the same thing, and probably within a week or two, we're going to see Moderna approved for children 12 and up as well. What we haven't seen yet is studies looking at the vaccine in children 11 years of age and under. And so that's what the World Health Organization is saying, is that we haven't studied the vaccine in these age groups, and until we study it, we shouldn't be vaccinating those age groups. And so that's exactly what we're doing in Canada and here in Niagara. Children under 11 years of age and younger aren't able to get the vaccine right now because we haven't studied it, and we need to have it studied rigorously and approved by Health Canada before it's safe to give it to that group. But for children 12 and up, it's been studied, it's been gone through some rigorous clinical trials, and we know it's safe now, and we know it works and really protects them from severe illness and from COVID-19. And so we want to make sure that that group who can safely get the vaccine does get it now.
Okay. And so a question about side effects. So what side effects can we expect from the second dose?
Yeah, one thing we know about the second dose of this vaccine is sometimes people have a little bit more in the way of side effects. And the thinking there is that that first dose has kind of primed your immune system, and it's trained it to recognize the proteins on the outside of that coronavirus vaccine. When you give that second dose and you give that training again, your immune system is already ready. It's already looking out for those proteins. So as soon as your body starts to produce them because of the vaccine, it's right on top of it. And so you start to have the kind of reaction your body has when it's trying to fight off an infection. So sometimes people will, get some muscle aches. They'll maybe feel a bit fatigued. They might get a little bit of a fever sometimes. And that's actually the immune system recognizing again that it's being trained to fight off COVID-19 vaccine. And because it's already primed and ready to go, those are the kinds of side effects that people are generally seeing. The one other one that we're seeing after the second dose is actually that myocarditis issue I talked about. And that's probably actually linked to that same mechanism. It's your immune system revving up to fight the virus, thinking that the vaccine is, again, training it to fight the virus. So it's all primed and ready to go. And so you'll get some of those kind of mild kind of side effects of fever, the fatigue, the muscle aches, and very rarely you might get that myocarditis, which would come across as a little bit of chest pain.
Okay. So for children, Do children need 2 doses of the vaccine, similar to how adults do?
Yeah, everybody needs 2 doses of vaccine to make sure that you get protection that lasts you the long term. And actually, with the Delta variant, we're seeing that this is actually particularly important. We're seeing with 1 dose of vaccine, the vaccine works about 30 to 35% of the time. Once you get to 2 doses, you're closer to 90% protection. And so getting those 2 doses is really important, especially with the Delta variant coming.
So another question is, my child suffers from allergies. Can they still receive the vaccine?
Yeah, so it really depends on what those allergies are. Most things are not going to be a concern for getting the vaccine. The allergies we'd be concerned about are polyethylene glycol and triomethamine being the other one, specifically only for the Moderna vaccine. So unless your child has an allergy to one of those, it should be safe to go ahead and get the vaccine. Allergies to both of those products are actually quite rare. So the vast majority of people should have no issue getting the vaccine. Obviously, if someone's never had an allergic reaction before to one of those 2 chemicals, there's always a first chance that you're going to have it. So anybody who gets a vaccine gets held back in our clinic for 15 minutes, just so we can be absolutely sure. If you have any further questions about the vaccine, about allergies to the vaccine, I definitely encourage you to talk to your healthcare provider, and they can confirm whether or not your child has an allergy to one of these or not.
Another question is, I have fainted when receiving other vaccines. Should I be worried?
I don't think you should be worried, but you should absolutely let the nurse or healthcare provider who's giving your vaccine know that you fainted in the past. Fainting is actually very common after getting a vaccine, particularly in teenagers and people in their 20s. And it's something that's normal, and so it's something that we can plan for. It just means that we'll try to make extra sure that you're relaxed. We'll keep an eye on you. If you're starting to feel faint, absolutely lie down to make sure if you do faint, you don't fall and hurt yourself. But it's definitely safe to get the vaccine. That's not really, something harmful happening because of the vaccine. It's more the kind of experience going around there, and there's obviously lots of emotions that happen with the vaccine, and it's perfectly normal and not something you should worry about.
Can I take my regular medication?
Yeah, you can absolutely take your regular medications, and you're definitely encouraged to keep taking your regular medications. The medications shouldn't interfere with the vaccine or vice versa.
Okay. Can I book my vaccine if I don't have a health card?
You can book a vaccine appointment if you don't have a health card. It's just a little bit more complicated. Your easiest path is if you're a family physician or you have a pharmacy nearby who's providing vaccinations, you can absolutely go set up an appointment with them and you're good to go. If you want to go book an appointment through the provincial booking tool, so you can come into public health or you can go to the clinic run by Niagara Health at the Seymour Hanna Arena, what you'll need to do is you'll need to give a call to us in public health, and we'll be able to book you in for an appointment that way. So you won't be able to book online. You'll need to get a call from us, and we'll actually give you what's called a pseudo health card number. It's basically a number that substitutes for your health card, and then you'll be able to go into the online system and book the appointment.
Awesome. Next question. So someone I know tasted metal immediately after getting the first dose. Why is that?
Yeah, sometimes getting a metallic taste like that can be an allergic reaction that someone is having. So it's possible that person was having an allergic reaction to the vaccine. We do know that that kind of metallic taste, though, does occur sometimes when people get, certain other kinds of, in touch with other chemicals. So it's possible they're having a other kind of reaction to the vaccine. So if you do have that kind of taste, I think let one of the nurses or other healthcare providers know you're having that taste in your mouth, so they can watch to make sure you don't have anything else that is consistent with an allergic reaction. I definitely encourage you, if you did have that, to let your healthcare provider know so they can submit one of those reports about an adverse event to us, so we can make sure this is documented as well.
Should I be worried about the long-term side effects of the COVID-19 vaccine with my child?
Yeah, so I think a lot of people are really worried about these, potential long-term side effects. And I think, everybody obviously doesn't want the vaccine to have a negative effect on people. We're trying to give the vaccine to hopefully protect people. we have never seen a vaccine that actually has long-term effects on people. If you're going to have a side effect to a vaccine, it happens within the first couple of weeks, and that's when you're going to see it. So, long-term effects are really not something we've ever seen with another vaccine, and we have no reason to think that we would see this with the COVID-19 vaccine. The first people who got the vaccine have got it, 6 months ago. The first people who got it in some of the research studies were 9-10 months ago, and there's been no evidence of anybody having long-term side effects from the vaccine. Where we do see long-term side effects is unfortunately actually with people who get actual COVID-19 vaccine. And we're actually seeing that virus, or sorry, not COVID-19 vaccine, COVID-19 infection. And what we're seeing, unfortunately, is that virus actually sometimes manages to get into your nerves and travel up to the brain. And some people actually have some long-term neurological effects. They, never get their sense of smell back perfectly, or they have this brain fog that persists. And there's people who've had infection and a year later are still having that side effect. And so the long-term effects are really actually tend to be from getting the infection. And we want to give people the vaccine because we don't see long-term effects from the vaccine, and it'll protect those long-term effects from the infection.
Can I be tested for immunity to COVID before getting my vaccine?
So, sorry, getting immune tested before getting the vaccine?
Yeah, tested for immunity to COVID.
Yes. So that wouldn't necessarily be recommended. The first thing to note is that your body's natural immunity after having an infection isn't always going to be as good as the immunity you get from a vaccine. We know this actually with some other infections. HPV infection, the infection that causes cervical cancer, we actually know your body doesn't actually mount as good an immune response to it as does the vaccine. And so getting the vaccine is still recommended there. Diphtheria is another infection where the vaccine gives you better protection than your body will naturally mount. We're not entirely sure of what the case is yet with COVID-19, but there's some evidence to suggest that actually the vaccine is going to give you better protection than your natural immunity, particularly as we see these mutated versions of the virus, the variants such as the Delta variant coming on the scene. It looks like the vaccine probably is going to give you better protection against that than will having had infection in the past. And so we definitely recommend, even if you've had COVID-19 in the past, you want to get vaccinated again. And so it doesn't make a lot of sense to really get checked for immunity because you're going through the test for that when you still probably want to get the vaccine because it's going to give you better protection probably against the infection.
And can you tell us about the COVID-19 vaccine trials, if you can tell us a bit more about that?
Yeah, for sure. So anytime we're going to approve a vaccine, Health Canada requires some really in-depth studies before they're going to let that vaccine be used on the population. With something like the COVID-19 vaccine, the hope is actually every single person in Canada is eventually going to get that vaccine. So we need to make sure absolutely that that vaccine is very safe and it works before we're going to allow it to be used on millions and millions of people across Canada. So when they start developing a vaccine, they start off, of course, doing research inside test tubes. They're seeing how that potential vaccine that they've developed is going to react to cells inside a test tube. They then move on to doing some tests on animals. And then they move on to 3 phases of research studies in humans. The first research studies is going to be 10, 15 people. They're going to give the vaccine. They're going to see, was there any side effect from the vaccine? What did it do in terms of developing antibodies against the infection? And if it clears that, it then goes on to a second phase of trials where we get a few hundred or possibly into 1,000 people getting the vaccine. And again, we're really looking to see, are there any safety issues that pop up, maybe 1 in a few hundred, 1 in 1,000? Now that you've vaccinated that many people, you can see, are there any safety issues popping up? And then again, confirming that the vaccine is still effective. And if you know that the vaccine is not popping up with anything once you vaccinate a few hundred people, that it's that safe, you then move on to a third phase of trials where you're going to vaccinate tens of thousands of people. And so the Moderna vaccine, the Pfizer vaccine, actually each had multiple phase 3 trials in different parts of the world, which encompassed 60, 70,000 people all at once being vaccinated. And they got people vaccinated and they followed those people over time to see, did they get COVID-19? Following also another people who are unvaccinated and seeing, did they get COVID-19, and comparing the people who are vaccinated versus the people who are unvaccinated, who is more likely to get COVID-19. And what they saw is in the people vaccinated, there's about a 95% reduction in people getting COVID-19 compared to the people who were unvaccinated. And there's a 100% reduction in getting hospitalized with COVID-19 if you're vaccinated versus if you're unvaccinated. And so based on that, multiple phases of trials going from test tubes to animals through 3 different phases in humans, we are able to see the evidence that these vaccines really did work and that they were very safe. And then Health Canada, based on that, has approved them for use in Canada. And then, as I mentioned, now they're going back and repeating those kinds of studies in younger age groups, so we can hopefully get a vaccine you can use across all age groups eventually.
Thanks so much for that, Dr. Hirji. Another question, I have 2 children born with NAIT. Is it safe for them?
Yeah, I'm not very familiar with NAIT. So, I think the best answer here would be to follow up with your primary care provider or pediatrician or whoever is following your children for those issues, and they can give you a definitive answer. Right now, there are no medical problems that have been identified that should be a reason not to get vaccinated. The only reason someone would not be able to get the Moderna or the Pfizer vaccine is if you have an allergic reaction to one of those 2 chemical compounds I talked about earlier, the polyethylene glycol or triomethamine. So unless you have an allergic reaction to that, you should be safe to get the vaccine. So with any kind of underlying health condition, you should be safe to get the vaccine. But I think it makes sense, because I don't know that specific medical issue, to talk to your primary care provider, and they can give you that definitive answer there.
Going back to the trials, was a blind placebo used, or was it tested against a different vaccine?
Yeah, it was tested against a different vaccine, but the people receiving the vaccine were blind to which vaccine they received, I believe. But it was compared to people who got COVID-19 vaccine versus, I can't remember which vaccine it was. I think it might have been a tetanus booster.
Okay, so do you know how many people got COVID-19 first? Do you know how many people got COVID-19 who received their vaccine? So how many people who received their vaccine got COVID-19?
Yeah, I don't have a number offhand. We do see, unfortunately, a small number of people who have been vaccinated have gotten COVID-19, but the majority of people we see who are cases of COVID-19 are unvaccinated people. And I showed you on that earlier graph, the majority of people in Niagara now, about 65% of people in Niagara now, have been vaccinated, yet probably 95% of our cases are in people who have not yet been vaccinated. And so definitely it's that 35% who are unvaccinated are making up almost all of our cases. So we definitely know the vaccine is protecting people. Likewise, in the UK right now, when they're seeing the Delta variant spreading, it's overwhelmingly in the people who are unvaccinated and getting it. So I don't have the precise numbers with me, but that it's absolutely, protecting people from getting ill right now.
Okay. And there's been talks about having a booster shot in a few months. Can you speak to that a bit more?
Yeah. So one of the things we don't know about this vaccine is how long your immunity is going to last. We know, for example, with a flu shot, we need to get the flu shot every year because after about a year, our immunity to the vaccine wears off. When COVID-19 vaccine was released, obviously we weren't going to spend 5 years to watch to see what happened with immunity because we are all getting sick from COVID-19 right now and we need the protection from it. So we'll only know over time if a booster shot is going to be needed to bump back up our immunity after a few years. Right now, the first people who've got the vaccine, looking at 6 months and 9 months down the road, there doesn't seem to be any evidence that immunity is waning. So right now, it's not looking like we're going to need an annual booster shot. But whether we might need a booster shot every 3 years, every 5 years, every 10 years, I think the jury is still out on that, and we'll need to find out about that. The one other reason we might need a booster shot is if we keep having new variants emerging around the world, and we might need a booster shot that improves our immunity against some new kinds of variants that are able to, evade the vaccine's protection. Thus far, it looks like the vaccine remains really good against the variants so far, but if there are new variants, that could be another reason why we might need a booster shot.
Can you tell us the main reason why young people are not wanting or hesitant to get the shot?
Yeah, I don't really know the answer to that. I have a few thoughts, but I can't really know for sure. And I suspect it's different for different people, and it's not a single reason for people. I think every person makes very complicated risk-benefit judgment, and there's probably a few different things weighing on them. A few thoughts I'd have here is, first off, I think young people have not seen as severe illness from COVID-19 as maybe elderly people have. And so maybe the motivation there and the fear of the virus isn't as strong. So the motivation to go out and get vaccinated hasn't been quite as strong. I think another reason here could be that, uh, young people, I think, haven't lived through the time when we had lots of diseases that vaccines helped us prevent. We've grown up in the time when we haven't seen a lot of measles around. Younger people than me haven't seen much chickenpox around. We haven't seen diseases like diphtheria around much. And so, elder generations who really saw people getting those, and maybe knew people who unfortunately got very severely ill or potentially died of something like measles, and have seen how vaccines have prevented that, I think they tend to have a lot more faith and interest in vaccines because they've really seen with their own eyes how effective vaccines have been. And we, as younger people, have not had that opportunity. So it's more a theoretical benefit than one we've been able to see with our own eyes. I think another thing for young people, though, is just the nature of their lives sometimes. Young people may not have a lot of income yet. They might not have a car to be able to drive to a vaccine appointment. They might have really busy lives going on. If you're a young adult who maybe has young children, things are really busy, and getting and booking a vaccine appointment is maybe not the top of your list. And maybe when you do go to book an appointment, you see that, oh, it's 2 weeks out or 3 weeks out before there's an appointment, and you're not really sure how predictable your schedule is going to be down that road. So maybe you delay booking an appointment. I think some of those could be the reasons going on for what's happening, but really, there's a bunch of people here who are unsure about getting vaccinated. And I think hearing your feedback is really going to give us much better information because you're the real people who are grappling with this question right now.
If my child receives both vaccines, is there a chance that they can still catch COVID?
Yeah, unfortunately, no vaccine is 100%. So it is absolutely possible that someone can still get COVID-19. As I talked about with the Delta variant, we see that the vaccine is about 90% effective. So your risk is reduced by 90%, but still about 10% of that risk remains. Part of the good news is, though, even if you still get COVID-19, you tend to get less severe illness from COVID-19. So while the vaccine is about 90% effective at preventing illness, it's about 96% effective at preventing hospitalization. So even if you do get illness, it tends to be a more mild illness. And so, unfortunately, we don't have the perfect vaccine yet. We've never been able to achieve that kind of perfection, but it has a huge reduction in your chances of getting sick and an even bigger reduction in your chances of getting very sick and severely ill.
How do I know that the vaccine won't change my DNA?
Yeah, so the vaccine won't change your DNA because it has nothing inside it that can actually affect your DNA at all. So what the vaccine, the Moderna and the Pfizer vaccine does is it contains something called messenger RNA, which is a string of basically, it's not quite DNA, it's kind of related to DNA. And what that does is basically the blueprints for making proteins. And so when it goes in your body, your cells take a look at these blueprints and it starts to produce the protein that the blueprints tell them to produce. And if you've seen the COVID-19 virus, it's this ball, and they usually show these kind of clumps around it. Those clumps are called the spike protein. And so that's actually what those blueprints are telling the cells to do. Start creating those spike proteins. So your body creates the spike proteins. Your immune system says, hey, this isn't normal inside a human body. This is something foreign, and it goes off and basically kills those spike proteins. And that messenger RNA, like a blueprint is a piece of paper. If you keep using it, it eventually wears out and falls apart. And that's exactly what happens to the messenger RNA. It basically falls apart and it gets, dies, degrades inside your body, and it's gone. And there's no point at which it's coming in contact with your DNA. No point in way could it be integrated into your DNA because it's not DNA. It can't fit inside your DNA. So there's absolutely no risk to your DNA. All this is doing is providing instructions to your body to create this protein, which then trains the immune system to fight that off. And that's really essentially how every other virus we have works, or every vaccine we have works. Every vaccine is basically taking some proteins linked to to the infection you're trying to prevent and showing it to your body so it creates the antibodies to fight off that if it ever sees that. And there's different technologies how you can present that to the body, but at the end of the day, it's all really trying to do that same thing. And this vaccine is just doing that, just with a different way of going about it.
And will the immune system be weaker by relying on a vaccine?
No, absolutely not. What the vaccine is doing is it's kind of training your immune system so your immune system is even better prepared to fight off COVID-19 vaccine. And of course, all your other immunity doesn't change at all. Your immune system is still there to do everything else. So after being vaccinated, you have better immunity, not worse immunity. It's going to be at least as good against every other infection that your body is able to fight off. And it's going to be far more effective at fighting off COVID-19. So there's no loss of immunity by getting vaccinated. It's only improving your immunity.
So similar question to before, I heard a few young people are afraid that the vaccine will prevent them from having children. Can you speak further to that?
Yeah. So, again, this seems to have been a rumor that started to spread on the internet. And there haven't been any scientific studies in any way indicating that this is a concern. Likewise, there isn't any real theoretical reason why these vaccines would have an effect on someone's reproductive system or their fertility. And we have a track record of the past 80 years of making vaccines. We've never had a vaccine that's affected people's reproductive system or their fertility. And so there's no reason to think that the vaccine is going to have any impact on reproduction. It's going to have any impact on fertility. I talked a little bit earlier about what we do with vaccine adverse effects and how whenever someone has some unusual effect after the vaccine, it gets reported to us in public health. We keep a document on it and it builds and builds to this huge database really across the country and even around the world, where we can start to see patterns of what might be unusual effects that might be happening after vaccines. And we're not seeing fertility or reproductive effects being anything along those lines. The only reason this is out there is because some people on the internet started to talk about it as a rumor, and it sort of has spread from there, and there's really no basis to it behind that.
Is it safe for children to get the COVID vaccine if they've already received the flu shot this year?
Yeah, it's absolutely safe to get the COVID vaccine after getting another vaccine. Obviously, most of us have had many, many vaccines over the course of our life, and it's always safe to get that next vaccine. So it's absolutely safe to get the COVID-19 vaccine after a flu shot. We do recommend that you do wait a few weeks between your flu shot and the COVID-19 vaccine, just because the COVID-19 vaccine is new and we're just talking about side effects, that if you did have a side effect of the vaccine, we'd want to know that this is due to the COVID-19 vaccine. It's not from the flu vaccine. So we can make sure we understand what those side effects that might be emerging are. But I'm sure nobody got their flu shot in the last couple of weeks because we're long past flu season. So I don't think that's a concern for anybody right now.
Does my family still need to get the vaccine even if we got COVID-19?
Yeah, no, it's absolutely recommended you still get the vaccine. As I talked about a few minutes ago, we do see with some infections that vaccine provides better protection than does getting natural immunity. That happens with diphtheria, it happens with HPV, and it seems to be the case with COVID-19, where you do get better protection by being vaccinated than you would just by having the illness naturally. And of course, the other part of that is that with the new variants emerging, we see the vaccines are much better giving protection against it than you having had an infection from a different version of the COVID-19 virus in the past. So absolutely, everybody's recommended to get vaccinated, even if they've had the infection already. It's going to give you even better protection that way.
Some people say that by wearing masks, we are not allowing good germs to help us strengthen our immune system. Is this true? Because I might want to wear a mask during flu season.
Yeah, so I will likely be wearing a mask this coming flu season, so I would definitely recommend that. I think one of the things we've learned over the past year is how effective some of the things we've done to stop COVID-19 basically made flu disappear. We basically didn't see any flu this season because it was so effective at stopping flu. Um, you know, when you get a vaccine, as we talked about a few minutes ago, what that vaccine is doing is it's helping to train your immune system. It's giving that immune system a workout. And so the vaccine, all it does is improve your immunity. It's not going to harm your immunity at all. You could be exposed to other germs out there. We're obviously still going to be exposed to other germs that aren't respiratory viruses, as we go forward. We'll get to a point where masks won't be needed quite as often. We're going to still be eating food and having the odd unfortunate foodborne illness. So we're still going to be exposing ourselves to some of those germs and still getting illness from that. But our immune system will hopefully be able to fight those off. What we don't want to see is getting COVID-19 and having some of the really severe impacts of COVID-19. As I showed, we've definitely heard lots of people have had to be hospitalized, been in the ICUs and on ventilators with COVID-19. We've seen children, unfortunately, be in the ICU and in some cases die from COVID-19. We're seeing people have long-term neurological side effects after having the COVID infection. We don't want anybody to have some of these due to having the infection. We want the vaccine to really prevent these, and getting exposed to the virus and having some of those side effects versus having the vaccine protect you from those side effects of the virus, I think is far better than choosing to, expose yourself to the virus, get the illness, and take the risk of getting one of those severe outcomes.
So lastly, regarding Section 22, when can I eat with friends on a patio?
Yeah, so we're looking for cases to come down a little bit lower. When you're out dining with friends, you're of course close to people. You're not 2 meters apart, and you're not going to be wearing masks because you can't really eat while wearing a mask. And so it creates that perfect environment for infection to spread between people. And your risk of infection is partly that activity you're undergoing, but also how much COVID is out there in the community and what is the probability the person you're eating with potentially might have COVID-19. And a couple of weeks ago, our cases were still pretty high. They've come down to actually less than half of where they were just 2 weeks ago. And we've set some metrics about when we can hopefully allow people again to be able to dine out with others. And we're getting very close to that. So it may actually only be a few days from now that this will be something everybody's able to do again. Don't want to, set an artificial timetable. We're going to base this on, how many cases we're seeing out in the community and what the real risk is for people. But hopefully that is coming soon.
Thank you so much for answering those questions for us today, Dr. Hirji. So I can see that we're kind of closing out on time. So to end this, do you have any takeaways for us today?
Yeah, I think the takeaway really comes back to partly where I started, that, we've seen COVID-19 go up in parts of the world that are affected by the Delta variant. And the infection is really concentrating amongst younger people, amongst teenagers, amongst people in their 20s and their 30s. And these are the groups that have the lowest vaccine uptake yet. And while they don't as often get severe illness as our elderly population, they do absolutely sometimes get hospitalized, sometimes end up in ICU, sometimes pass away. And for those who don't have a severe outcome, they will sometimes get some of those long-term neurological outcomes. And nobody wants that to happen to anybody, least of all to our children. So we absolutely do want to make sure everybody gets vaccinated so they can avoid some of these severe outcomes and they will be protected, particularly as those variants are on the spectrum, that they're threatening to cause even more severe illness and they're threatening our young people even more as being the group that's most affected. We want to make sure everybody has protection so everybody can be safe out in our community and we can start to get back to normal here. So that's, I think, really the key message. If you have other questions, you remain unsure, please do reach out to give us a call at Public Health. We'd be happy to answer your questions. Give a call to your family physician, your pediatrician, or healthcare provider. They'd be very happy to talk to you about this. Make sure you get your answers, to the questions you have, so you can make the informed decision for yourself and your family.
Thanks you once again, Dr. Hirji, and thank you everyone for joining this night's session. If you missed anything or you want to join again tomorrow night, it'll be same time, same place, same link. Join us for more questions. Again, there's more information in the chat and everyone stay safe and have a lovely evening.